And welcome back to The Factor Uncensored. Men and women often seek out enhancements when they need help in the bedroom. Sometimes it's in the form of pills or certain procedures. But is it all safe for everyone? We talked to a doctor about what you need to know before you get that enhancement. And joining us here on The Factor Uncensored tonight is Dr. Marcel Thompson, and we're talking about both male and female enhancements. Now, before we get into the nitty-gritty, Dr. Thompson, let's talk about the reasons why you should and should not get male and female enhancements, depending on your psychological reasoning behind it or your motivation behind it. So let's start with why shouldn't we get it?
Well, why you shouldn't get it, if you have any particular health concerns or health problems, you shouldn't get it. For instance, if you have problems with controlling your blood pressure or you're taking another type of blood pressure, you really don't want to kind of deal with, or at least seek medical advice, because a lot of the medications that are out there for enhancement really do start to affect one's blood pressure. And if it lowers your blood pressure, sometimes it can lower your blood pressure to a very dangerous level. So if you're having blood pressure issues, first try to check with some type of healthcare director. Another reason why you might not want to try to pursue it at an early age is that you get used to it. You get used to the enhancement and having to perform as you get older. You're going to always want to be able to perform at that same level. So if really not needing it, really don't kind of go into that realm.
And what are some of the procedures out there for both men and women? Let's begin with the women. What enhancements could women get?
Right now, there's a host of things. There's Prp Therapy, which Prp Therapy was usually given in the face, but it recycles or regenerates one's cells. And we usually put it in the vagina, the clitoral region, to help regenerate those cells. Increases more excitement when the woman has it at that particular sexual stage. Also, there are different various machines that are radio frequency machines that are able to stimulate the collagen in the vaginal tissue, which sometimes will make it either increase in lubrication, and sometimes in some women it'll appear that it tightens the vagina.
And so
those are some of the treatment areas.
And when your patients come to you for a consultation in a situation like that, are they sometimes not clear what they need, but they kind of describe to you what they want?
Correct. Yeah, I usually like, in my history and going through and sitting down with the patients, part of the history is taking sexual history. How are you satisfied sexually? Do you have any pain sexually? Are you having problems with urinary incontinence? Those are some kind of leadway questions that we kind of lead into that. And they would start to, open up and say, well, hey, I'm not having as much orgasm, depending on the age, or sometimes they get a little bit more out of it.
And let's talk about male enhancement. What's out there for the men?
Male enhancements have come along a long ways from the Viagra pills, but usually the PD-5 inhibitors are pretty good, like Viagra, Cialis. Usually that's what we kind of start with, or actually you can go start with before that with things sort of like L-citrulline, things that increase our we call nitric oxide inhibitors that dilate the vessels. Some people say ginger or ginkgo biloba. And then we have from the PD-5 inhibitors, we have also the injectables where you inject it direct into the penis in similar ways, we increase the vasodilation of the penis, which increases erection. There's also, we have Gaines wave, and there's a Prp therapy for men, which helps regenerate the tissues in the male penis.
And how freely are men coming forward saying, this is what I need, or do you have to kind of figure it out with them, like with a consultation with any patient?
Yeah, I think so far as with men, we start to lose. I try to base a lot of my judgment on where a man's testosterone levels are. would start to fall as early as 35, sometimes sooner. And the baseline or good testosterone level, increased testosterone level, we understand will increase one's libido. So we would start there with a comprehensive exam, and let you know that 34% of males who present with erectile dysfunction have some form of maybe early signs of diabetes, but some of their first presentations may just be with erectile dysfunction.
And that'll do it for us here tonight on The Factor Uncensored. We want to remind you to follow us on social media on these various platforms: Instagram, Facebook, and Twitter at Isaiah Factor Uncensored and at Isaiah Factor on Twitter. And don't forget to download the Fox Soul app. You can catch it on foxsoul.tv, and Fox Soul has its own YouTube channel, so check us out on Fox Soul. We want to thank you for joining us tonight. We'll see you back here the next time.